Good morning, and thank you for joining us this morning for this webinar on Disrupting Disproportionality. My name is Dewana Jernigan, and I'm the President and CEO of Arms Wide Adoption Services. So some of you may not be as familiar as others with Arms Wide Adoption Services, so I want to take a little time to share with you who we are. Arms Wide is a for-impact organization with a 44-year history that's deeply committed to transforming the lives of children in need of safe and permanent nurturing families in the Houston and South Texas areas. Arms Wide Adoption Services, formerly known as Spalding for Children, was originally established in 1977 in Houston, focused on aiding the overwhelming number of children who were removed from their homes due to abuse or neglect and placed in the state's protective custody of foster care. Since our inception, we have continued to expand service provision to include not only foster care, but also to adoption, post-adoption services, and the newest addition to our service continuum, post-permanency support services for caregivers who have permanent guardianship of their relative or kin children. We're currently the only state contracted provider for this service. In 2017, Spalding for Children rebranded as Arms Wide Adoption Services, and we continue to provide services to strengthen and support families throughout our service continuum. Now that you know a little bit about us and what we do, I'd like to share with you a quote from Clara Hosa, which reads, "The choices we make today create the future that we're dreaming of." On May 25th, 2020, the murder of George Floyd sparked a national uprising amid a global pandemic called COVID-19. Both Mr. Floyd's traumatic and very public murder and the health crisis that we continue to experience, hence this virtual presentation, have proven both traumatic for most of us, if not all of us, and have sparked conversations about the issue of racial disparity and inequity that's inherent in our child welfare system today. We all know that adverse child experiences like abuse and neglect have lifelong negative impacts on individuals' well-being. But wouldn't it be amazing if there were ample supports and interventions available to prevent these experiences from happening in the first place? And wouldn't it also be amazing if there were families, ample families, to care for children who needed protection, who were in out-of-home care, and that all of those children, regardless of race, were able to be matched with families to care for until they could achieve permanency? Those seem like some pretty rhetorical questions, I'm sure. But what I want you to do today is to imagine what you can do today to advocate for changes that can make that possible tomorrow. And so we hope that the information you receive today invigorates you to continue doing the work that you're already doing, and that it also inspires and empowers you to continue to be part of the change that you want to see for children and families involved in foster care. Today, you're going to hear from some phenomenal people who will share their expertise and experience on this issue. So before I introduce our next two speakers, I would first like to draw your attention to a few housekeeping rules that are housekeeping issues that you may have become familiar with over the past year if you've been working and conducting and participating in webinars via Zoom. We're going to ask that you please submit your questions using the Q&A feature. As a reminder, during a Zoom webinar, you're not able to turn your camera off and on at your leisure. So we encourage you to engage in the webinar by using the Q&A feature. Also, for those of you who are interested in CEUs, you're going to be receiving an email with a link to the evaluation within 48 hours of the event. So when you registered, there was an email provided. Your information or the link will be sent to that email address. If you have any other issues, please feel free to reach out to Ashley Sims at asims@armswide.org with questions. Ashley is our training and recruitment supervisor here at Arms Wide Adoption Services and is the host for this webinar that you'll be participating in today. And before I introduce the speakers, I also want to share gratitude to Houston Methodist through their generous support to enable us to be able to have this webinar and support today. So without further ado, We have a couple of speakers here today who will be sharing opening remarks with you from our Region 6 leadership. First, we'll have Leshia Fisher. Leshia is the Regional Director for Region 6B. And after Leshia is finished, we will have Shaundricka Easley with opening remarks as well. And Shaundricka is the CVS and FAD Program Administrator for Region 6A. Welcome, 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 and thank you. Leshia?
Good morning, everyone. Dawana and Ashley, thank you both for inviting us to come and speak with your group today. I know that everyone who works in the child welfare system is concerned about this topic that you all are introducing today. And so I wanted to give you all a little background on where and how the department became a great partner in this work. In 2005, the Texas legislature mandated that DFPS examine and address disproportionality in our child welfare system. And we found throughout that analysis that there was truly an issue, a concern, or a problem, that we needed to do something to address it. And guess what? We found that there was a problem. So in our system, it clearly indicated the disproportionality existed in all stages of services within the department. And as a result, legislation was incorporated. It has been incorporated into our Texas Family Code, and it mandated that the agency develop and deliver cultural competency training to all of our staff. It mandated that we increase our targeted recruitment efforts to ensure diversity among our staff, and that we develop targeted recruitment efforts in our communities with our partners, our agencies, our nonprofits, our faith-based organizations, so that we together can operate in a culturally competent system in which children and families of all races and all ethnicities were served. This legislation passed because it is needed. It was needed, and it is still needed today, as Dawana mentioned in her opening comments. We are charged as an agency to make sure that all of our programs that we have put in place are there to help reduce the disparities that have been identified in the analysis that started in 2005 and continues today in 2021. We must make sure that as we work with our children, we understand who they are and what they are. They are simply not numbers. They are people. They are involved in a system not by their choice of themselves, but by the choices of the adults who reached out for them, looked out for them, cared for them. And so we have a responsibility, each and every one of us, participating in this call today, this webinar today, and even the ones that are not here. All of us are called to action to take what we hear today and move it forward. We have a responsibility to make sure as an agency, DFPS, as your agency, to make sure that we put forth that cultural responsiveness that is needed to everyone, our youth, our parents, our stakeholders, our community partners, that we share the data that has been out and presented, and that we all understand disparities truly exist. We can't turn a blind eye to this. It's not possible, because if we do, the people who end up getting hurt by this are the children we all step in to protect every day. Region 6B and Region 6A have a motto. Region 6A says all hands on deck. Region 6B is every child, every day. Put those two together, and that's who we are in Region 6. All hands on deck to protect every child, every day. But to do that, we've got to make sure that we are incorporating the strategies that have been identified in all of our practices. We should be looking at our disparities in our child welfare system, in our processes of conservatorship. How are we utilizing it in kinship care? How are we utilizing strategies in family group decision-making? How are we using it in our permanency care assistance, our fatherhood initiatives, our parent collaboration, and yes, permanency? We must look at all of the takeaways that have been identified that children of color are disproportionately represented in the population in Region 6 overall. That poverty in our areas is having a negative impact on the number of children that we're bringing into our system. And that we know that children of color are more likely to live in these areas of concentrated poverty. So what else do we know? We also know that in these areas, there's a lack of preventive community level resources. And that's where you all come in to help support the families and children in these areas through your great programs that are already existing and that you all are moving forward. We can share data with anyone who is willing to listen and see that data. But beyond the data, you must know the stories. You must know who these children are. You must understand why they came into care. As I said before, these are not simply numbers. These are children. These are people. And for all of us to address what is needed, we must understand the problem. I encourage you to listen today. I encourage you to incorporate the strategies and practices that you hear today. I encourage you to know that for all of us to move forward together as partners, we must enhance our partnerships. We must be able to engage youth and families in all of our initiatives in your agency as well as this agency. That we've got to look at capacity building across all stages of services so that we're serving the children that are present in our system today. That we've got to understand that our decisions impact so much more than just ourselves. Our agency policies, our procedures, and our practice and our training is important. And that's why you're here today, to listen to all that is going to be given to you. I encourage you to use everything that you're hearing, the steps, the strategies, and move it to the next level. I know within DFPS, we have our DFPS practice model, and it provides our staff with a framework to organize all of our efforts and to establish the parameters for best practice as we deliver good outcomes for children and families. Our practice model is at all levels of the organization. And our one core principle of the practice model is equity. Equity in outcomes, we can achieve that. We can have that by applying all of our methods across this entire agency, across this entire state, fairly and consistently. And the one thing that I want you to take away from today is that when you listen to everyone, you're going to hear that our interventions into the work that we do must meet the children and families who we come into contact. It must be uniquely designed for them. It must look on the community in which they come from for them. And so we challenge you, just as I challenge my staff every single day, to do the best work that you can to change the landscape of this child's story, of this family's story. Disparities are there, but we can overcome that if we work together. And as a representative of the regional directors, not only from my region and CJ's region, but the other regional directors across the state, I say thank you to each and every one of you for being here today and willing to tackle the problem. I am just really, really proud of that. This is one of the continuing efforts to improve the disparities across our system. I encourage you again to take action, to listen, to engage, and then put everything you're hearing today into practice as you move forward to ensure permanency for children. Thank you.
Thank you, Leshia, for sharing your perspective and those encouraging and inspiring opening remarks. And at this time, we'll ask Shaundricka Easley for opening remarks.
Good morning, everyone. Thank you guys for joining us today. Thank you, Ashley and Dewana, for asking me to speak on this panel. I'm very appreciative. As Leshia mentioned, obviously disproportionality occurs in all stages of services. And so that's at removal. That's during conservatorship. And then we know that those same kids that we treated disproportionately remain with us until they're 18. We know that those are the kids that age out of care, unfortunately. And so we really have to think about the why. And so when I first became a manager, I think way back when, I heard the term gatekeeper. And I realized what a gatekeeper was. I realized that I was a gatekeeper in either imparting my bias or not imparting my bias. And it was my obligation as a manager to teach and train my staff not to do that same thing. I was obligated to go to the meetings and meet families and be at the table to meet them where they were because I am a gatekeeper. I also understood that because I'm a gatekeeper, that sometimes our policy didn't do right by certain folks. We look at that criminal history chart and we take that as fact and we say, you know what, we cannot place. And we're not willing to push the envelope to even get that placement with that family member, therefore leaving that kid in care. And so I guess here was my turning point. When the Trayvon Martin shooting happened, I really took a lot of inventory in like what it meant to call the police on not just our kids, but for anybody, what those interactions meant for our families. And that's what really made me turn the corner in looking at that criminal history chart. Because I know that if somebody calls the police on me, I'm not going to be happy. So guess what? I'm going to be seen as somebody who's argumentative, and I'm going to be seen as resisting arrest. So there's one misdemeanor to felony charge right there, right? And so then the charges stack on. And sometimes those altercations escalate to the point of sometimes where somebody loses their life. And so I really, like with all these headlines and news stories, I just started really considering the implications of what these systems can do to our families and what we can do to our families. And so in looking at those things, I really learned that I really had to turn the corner and really not take what was on that paper as fact and ask that person, who are you and what are you willing to do for these children and families? I often think like my grandmother, if somebody did a home study on my grandmother, it would be denied, absolutely. But I know that my grandmother is a phenomenal caregiver. I know I would trust her to take care of my 40-year-old self right now. And we have to, again, get beyond the paper. And I've challenged my staff every step of the way to get beyond the paper and meet these families in their homes, in their communities, to remove those biases. And so I really want to challenge everybody that's on this line to do that same thing. Meet folks where they are, meet them in their homes, get to know who they are, because they're more than just paper. And we're more than just this black skin. We are more than that. These kids have value, and we have to impart and show them that they have that value. We have to instill in them that they have that value. That's our jobs as providers, as foster parents, as social workers. We have an obligation to instill that value. So I challenge you today, every time you see a little black or brown girl or boy, Provide them with that value. Give them that value. Give them something that's going to enrich their life every day so that hopefully they won't be involved in these systems. Make those connections with people that they wouldn't ordinarily have those connections with in hopes that they can get out of these systems. When they're having those interactions with the police, try to intervene. The other day, we had a situation with a kid who I know was just triggered by the police being there because reading his case, his father was in jail, mom was in jail, grandfather had gone to jail. That's triggering for him. I'm not going to involve him in those systems. I'm going to talk to both of those entities to see how we can bridge that gap so that that kid can return to his placement, get what he needs therapeutically, continue to try to transition home. The police can go on about their business. Those are our jobs. As me as a gatekeeper, that is my job and that's my obligation. So I challenge each one of you to take something today and make it an action item. How can you make these things an action item? Thank you guys again.
Thank you.
Oh, go ahead.
Go ahead, Ashley.
Oh, I was just going to say thank you so much to both of you for sharing. I just kind of want to sit and chat with y'all for a little bit now. So, whenever you're feeling comfortable, let's plan lunch because I feel like I have so many questions and things that I just want to sit and learn from you, even just in the short little bit that you shared. So thank you so much for just being willing to come and to participate, show your face in the place, if you will, for those of you all who have your video on. And now it is definitely my pleasure to be able to introduce our next speaker, my former professor, my kindred spirit. When we worked on this initiative, she was the first person that I thought, and I hadn't spoken to her in years. I was like, man, if Reiko could come and share, I know that this work and just the mission of addressing the needs of Black kids in care is a passion point for her, and she has the research backing, the experience, and I'll let her share a little bit about the work that she's done and what she's doing now. But I'm very excited for y'all to hear from her and what she has to share about disproportionality within the foster care system. So I won't take up any more of your time. Reiko, you can go ahead and get started.
Thank you so much for that introduction, Ashley. And I also want to thank the speakers before me. And I'm really appreciative of this opportunity to be in this crowd and to talk about such an important topic today. Again, my name is Reiko Boyd. I'm an assistant professor at the University of Houston in the Graduate College of Social Work. I've been there about 6 years now, and the majority of my work has focused on racial disparities and disproportionality for Black families in the child welfare systems. And my practice background is in child welfare. I'm actually from California. Don't hate me. No, it's a lot of us moving here, but I was here before this whole migration was really in full force and effect. And I got my practice. My practice started in Los Angeles County, which is one of the largest child welfare systems in the nation, and actually started off in adoptions, later moved on to Santa Clara County, and I had a position there in what we called a community care unit, which was just majority adolescents, but a full caseload. So anyway, that's my practice background, and I always carry it with me the years that I spent in practice, and it shapes a lot of how I view this issue, and probably actually is the reason why I decided to take that step and go on and pursue research as a profession, because of the fact that going across neighborhoods, across communities, seeing the consistent patterns and seemingly intractable patterns of Black and brown families overrepresented in the system, and having questions about why is this so and what can we do about it. That's really what led me on my journey. And I am able to share my screen. Okay, I'm gonna go ahead and try to do this. I have a PowerPoint prepared, so let's hope that I'm not too rusty. Is it visible? Okay, so as I mentioned, I'm really grateful, privileged to be able to speak today on this topic, and I especially value this opportunity because most of the times when I'm talking about this topic, I'm talking in research circles, and that means we're talking in circles with many people who would push back and say that, well, you know, is disproportionality, is disparities for Black families, for African American kids in particular, is that really a problem, or is this something that we should expect, given what we know about risk factors for child abuse and neglect, et cetera? And I always make the strong case and argument. Of course, it is not so simple, but I say it and try to do that through my work and what I do. But in framing this, I'm hoping to actually speak to maybe those who are at a beginning point of learning about this topic, people in the community, or looking to get more involved, who may be thinking of, well, what does this problem actually entail? What's going on here? A little bit. Hopefully, I can give you just a quick, super brief snapshot of a little bit of data here in Harris County, and also to answer, just to give an overview of some of the reasons why, in explaining this problem, what we say on the research side, why this may be happening, and hopefully plant some seeds for maybe what can be done about it. I don't have the answers, but this is a topic, of course, I can talk on and on about. So every time I talk about disparities and disproportionality, I like to start by placing it in context. And what really is important is to understand that disparate and disproportionate outcomes occur in child welfare systems and across systems. So in terms of juvenile justice, physical and mental health, education systems, we know that there are adverse outcomes are disproportionately concentrated among Black children and families. And I like to place this in context. It's not to deflect and say that this is not a problem in the child welfare system, but I often think about the fact that if the child welfare system, we woke up tomorrow and our dreams were answered, our wishes were answered, and the system is functioning perfectly, whatever that means. If we have a perfectly functioning system, is that the end of our work? Have we arrived? Not the case. And that's because we understand that what's going on in society and the inequity that continues to exist. So there's also interconnectedness that's important. And I place in context these factors. There are narratives that impact how society views and treats Black families. That's related to also to implicit bias and how that impacts all of us, regardless of our background. We have messages that are fed through the media. We have historical and current context of unequal opportunities. And all of these factors are shaped by historic and current racism, as our country is a staple of our country since its founding, I would argue. And this is a context we're in. It's not to overload and say there's nothing that we can do about these issues, but it is important to place in context this topic. And just to understand that in the child welfare system, disparities and disproportionality occur across decision points. So from times that, in terms of families being reported, investigation, substantiation, placement, and then also through the back end, which I'll talk about more next here. So, and you can only see my screen, right? You can't see I'm trying to move around I want to see the faces at the same time, but you don't see that part, do you, Ashley? I just look at you. Okay, no, I want to see the faces, but I also want to see the screen. So there's my rest showing. I was on parental leave last semester. So as I mentioned here, we see decision points. So in terms of who's referred to the system, well, disproportionately Black families are referred to the system. They are reported they're more likely to be reported than other groups, more likely to be investigated once a report is received, more likely to be placed or enter foster care and enter the system compared to other groups once there's been a substantiated investigation, less likely to reunify, less likely to be adopted. And there are also some disparities in terms of exiting the system through other exits. So as I mentioned, we can think about in terms of increased likelihood compared to other groups. Other areas in terms of include frequent changes in non-kin placement. A positive is that kinship placements tend to be based on prior research, more consistent in terms of the length of stays in those placements, but there's other issues that I'll talk about in the less likelihood category. So African American children are more likely to wait longer for permanent placements, and they're also more likely to experience the termination of parental rights. In terms of their lower likelihood, they have lower likelihood of reunification with birth parents. There's some variation across the age spectrum there, but overall prior research it has demonstrated a lower likelihood of reunification in cases. There's also been disparity documented in terms of receiving the same frequency and quality of services. So this is in terms of support reported by foster parents, contacts by caseworkers, access to services such as mental health, some drug treatment services, et cetera. And again, as I mentioned, lower likelihood of adoption. So that is a general overview. When we say disproportionality and disparities, I'm going to get a little bit more technical and provide a definition, because I like to use both of those words because they mean different things. So that's important to understand, and I'll describe that next here. So in terms of definition and measurement, I think it's an important point, and especially just getting a baseline understanding. Well, what do we mean when we say disproportionality? So disproportionality refers to one group's representation in the child welfare system, that being out of proportion with their representation in the population. So when we talk about children in the system, a lot of times we're comparing it to their representation in the general child population. And so it's important to know what's going on in general. A lot of times what's most accessible to people like me is national data and figures where we understand, like on the grand scale, big picture, what's going on. And that's some of what I just finished talking about, is the general patterns that we see. But I really one thing I hope to emphasize today is that in the conversation around disproportionality and disparities, a lot of what's been neglected is the fact that there is a lot of regional variation, geographic variation. So there are differences from one state to the next. There's differences between what's going on in Texas and what we see. Just think about the demographics of the state compared to somewhere like New York or California, or a smaller state, say like Maryland. And you would want to pay attention, and if we're getting into the nitty-gritty, to understand some of the differences there. So back to my original point, disproportionality, we're comparing the children in the child welfare system, and we can take a specific decision point often and compare that to the child population. So I'll give an example of that used on the slide. Disparity, in contrast, it refers to inequality in group representation in the child welfare system. So it's used to describe inequitable outcomes experienced by one group compared to another group. So here, just to emphasize, the comparison group is different. When we talk about disproportionality, we're comparing the same group's representation in child welfare system to their representation of the child population. Disparity is more of a measure of one group's outcomes compared to another racial group outcome. And I think a quick way to demonstrate this and seeing how they relate is looking at how we actually measure this. So if we want to measure African American disproportionality just based on the statistics I have displayed here in this chart, one Harris County, and this is data from fiscal year 2020, African American children make up 18% of the child population in Harris County. However, they make up 47% of the children who are removed and placed in foster care. Okay, and by comparison, so that gives a disproportionality metric of 2.61. So we dividing the 47% by the 18%. If we want to look at what is disproportionality for the white children, well, white children make up 22% of the child population in Harris County, and they make up 16% of the children removed and placed in out-of-home care. So that yields a disproportionality metric of 0.73. So as you see, this is below 1. That means that white children are underrepresented compared to their numbers in the child population. And African-American children are overrepresented compared to their numbers in the child population. So, oopsie, excuse me. So in order to calculate to understand disparity and understand that this is a between group comparison. Now, I was remiss in that I did not include the simple equation, but basically it's dividing the disproportionality metric for the African American by the disproportionality metric for the white. So it would be the 2.61 divided by 0.73, and that yields a disparity index of 3.56. So all of that, so if that was irrelevant to you, let it slide off your back. If it's interesting to you, which I hope it was, then please take it and ingest it, because a lot of times when we may read reports or we hear these words thrown around, like disproportionality is an issue, disparity is an issue, but what does it mean when we just simply take a look at the data, and we can get have a pretty good and solid foundation for making our case, like this deserves more attention, this why is this the case, and should it be? This is pretty pronounced, right? And we see it right away. I just want to point, so I kind of spilled the beans and did present some of the Harris County statistics, but I want to take a step back and just show this is the case overall in the state of Texas. And this is, again, data, the most recent data provided by the state. So African-American children make up 12% of the state population. 17% of children reported to CPS. 20% investigated once reported, and 20% of those removed. So again, this just demonstrates, again, the disproportionality there. And what I want to point out is, I'm assuming I'm talking to a local crowd, and when we zone in and tune into Harris County, we see even more pronounced disproportionality. And this is what I just displayed, this 18% and 47% of children removed, as you see on the far side of the chart. But it just continues to increase by decision point here. So in Harris County, African-American children make up 18% of the child population, 32% of those reported, 36% of those investigated, and 40% of children removed. So if we were to go back and make those calculations again, this is my last calculation slide, so hang in there with me, everybody. But it's just to, again, demonstrate, okay, this is what we see. These display disparity indices for African-American and Hispanic or Latinx children. And so we can say here, well, compared to white non-Hispanic children, African-American children in Harris County are 2.5 times more likely to be reported to CPS. They're 2.7 times more likely to be investigated and 3.5 times more likely to be removed. Okay. Here's where I also take a slight detour and say, the focus of my research and my work has been on Black children and families. There are other groups that are definitely deserve also more attention in terms of just disproportionality, disparity, especially Native American Indian groups. In terms of the Latinx population, there's variation even within the state and across the country. In some places they're overrepresented and other places under compared to white children. And this is where I also make a side note caveat and say, like, this conceptually, this idea of comparing outcomes and having white children as a comparison group, it's what we do, but in my work I argue that it's not ideal, and that do white children have an ideal experience in the child welfare system? Is that what we're saying? No, not the case. This is how we're using data, we're using numbers to compare, but it's an imperfect practice. And I think conceptually there's opportunity to move beyond some of what we've done traditionally, and kind of seek to strive to other ways of measuring, other ways of looking and studying and understanding that actually translate to making inference about child well-being. Like, how are children doing? It's not just about a comparison to another group. How are Black children doing? What are we looking at in terms of well-being? And if we reach a disparity index of 1 and saying these numbers look the same and everybody's proportional to their composition in the population, have we arrived? I would argue no. But this is where we are, and I always like to point that out. Okay, so moving on, I won't go over everything on here, but I mentioned that what brought me to a research career and to pursuing doctoral studies and wanting to focus on this was this question of why is this happening? Why do we observe the patterns that we see? Where are opportunities for change? And in reviewing the host of studies, research on this topic, what I found was there was a lot of factors that were mentioned. Some were studies, some weren't, but there was not a lot of organized ways of thinking about this. And so I took that on as one of the tasks that I wanted to do. And how I wanted to basically put out some information and think about, well, if we want to understand more about why this is happening and hopefully talk about it in a way that's more holistic, what I found when I started studying about disproportionality and disparity is there's this idea that, well, it's happening either because there's poverty in Black communities, or that we know about poverty and how that's a risk factor for child maltreatment, right? Everybody knows that there's a lot of research there, and so African American families are more likely to be poor, so that's why it's happening. Then on the other hand, there was this whole debate in the research arena around, well, it's not poverty, it's really about bias. It's bias that people are biased and they're making these decisions, and it's either poverty or bias. And I really push back on that. And if you actually look at the literature, you'll see that those issues are factors, but there's more to it. So I like to organize this in a couple of a framework that looks at 5 different pathways, that's looking at what's traditionally called disproportionate need. I'll probably call it something else at this point, just because of the way that term has been taken and ran with in certain ways that I don't necessarily agree with. But this is just talking about the concentration of risk factors, what we know about poverty at the individual level, structural level, what we know about characteristics at the individual parent and child level. So an example of this is age. So we know that younger children have a higher rate of child maltreatment, especially under 1. And so that would be an example of a child factor. An example of a parent factor is, you know, we know that there's association between like experiences of mental health and substance use or substance abuse, and those as risk factors for child welfare system involvement. In terms of, as I mentioned, well, I'm not going to go over this whole thing. Can you tell that I would be happy to talk on and on about this? I hope that you can tell, because I definitely will be happy to follow up, and Ashley, invite me to that coffee or brunch or that you want to lunch you want to have, because I love to just hear from people and also to dialogue about this. But just to go over, so we can think about risk factors as creating disproportionate need, and the what's happened a lot of times is that's where we're starting, and that's where the conversation ends around disproportionate need. But the question is, the bigger and more important question is, well, why is there a disproportionate need? Why is there a concentration of risk factors? And here's where this bottom portion, the structural racism and geographic context, really needs to be placed at the center, because it has shaped each of these pathways. The specific history in this country and the current context in this country, structural racism has shaped disproportionate needs. So that means that if you want to know why there's, in terms of a racial disproportionality, in terms of risk factors being concentrated among Black families, then we can look structurally. I'll talk a little bit more about this moving on. But in terms of human decision making, I advocate for this as a category that's more relevant than just simply framing as bias, because there's implicit bias, there's explicit bias, there's differences in decision making. That's a basis of not a racial bias, but I'm making a decision different in this case than I would make in another case. And some of that might be due to racial factors, but some may not be. And then there's also factors such as lack of cultural competence, lack of cultural awareness. And I would argue that all those things are not synonymous exactly with bias, though there may be overlap. So we can look at the agency or system level. We can look at dynamics related to placement. So one example of this is Kinship Care. We look at it, I would argue, and research supports the fact that it's a more favorable placement, right? We want to keep children in their families of origin, and that is a goal that's ideal. However, there's some literature that says, well, kinship placements, they're like kids in kinship placements may have a longer time to adoption. Now, for those in practice, we understand that you understand those dynamics on why that might be, right? Sometimes kinship care providers are less willing or less likely to pursue adoption, or to be right on board with saying, yes, I'm going to adopt. Is that a bad thing? No, it's not. A lot of times that connects to awareness around culture, awareness around like family dynamics. That does not mean that it's less of a commitment to the child, right? But some, these are the nuances of what happens here. But if we're just using a statistic to measure length of time in a placement, then you may see, okay, longer time to adoption when kids are placed in kinship care, but how does that impact well-being? So anyway, I like to point that out, as that's a dynamic of placement that can influence the rates of disproportionality or disparity that we see when we look at placement level. And then there's also the policy impact. So lack of policy, and sometimes policy that's just considered universal policies. There's a lot of talk about some of the stipulations of ASFA, the Adoption and Safe Families Act, and how regulations in there impact Black families in particular. And I think I'm probably going over time, so I won't go into it. But I will take a little bit a step back and talk for a second about understanding. That was an overview, but here's where I want to place emphasis on understanding the external factors outside of the child welfare system that go back to that that line of concentration of risk factors and disproportionate, what some call disproportionate need. So there's a whole new life to this conversation in the research arena now, understanding the role of racism as a root cause in creating and promoting racially disproportionate exposure to risk for maltreatment. So this is not, it's not fully accepted or acknowledged of by everyone, but there's new, as I mentioned, there's new attention, new life to engagement in this conversation, and a lot of it has to do with where we are socially and politically, and even what motivated this whole webinar. So I just like to point this out and say, if we're thinking about ways to articulate and ways to understand, we have to go back and apply a historical lens, and understand the history of enslavement, dehumanization in this country, which included a legacy of forced family separation, and the enactment of laws and policy to maintain white supremacy. So those roots, those roots of racism influence these major domains of poverty, of health and stress, of inequality that's embedded across contexts. And all of these dynamics do influence, are at the root of influence of concentrating risk factors in certain areas, and also the disproportionate experience of racially disproportionate experience of risk factors. Okay. So if here's where I will start to wrap up and say, this is a little chart that I use to reiterate the pathways, but also if we're thinking about all of the factors that contribute to this problem, we can think of as many and probably more factors and actions that can be taken to address the issue. So I also like to organize those along these pathways. So if we're talking about disproportionate need, then we can look at efforts to reduce individual and concentrated poverty, to increase supports for families, affordable housing, job development, etc. We can look at intervening on communities, so community programs, etc. Human decision making. There's a host of things that can go on within agencies, within systems, and it's encouraging because I hear that this is going on even, and it sounds like at an individual and like unit level with strong leadership, but then also at a system level, and that's encouraging. And every piece of this makes a difference. Where I want to emphasize, perhaps for the audience today too, is that the efforts around enhancing and supporting kinship care are crucial and very important. And the fact that we have here, so I didn't create this chart for this presentation. I had it already, and thinking about and trying to organize and do some advocacy like in the research arenas, and hopefully influencing policy about what can we do. But we know that we need to, in terms of the here and now, we need more African-American caregivers. We need efforts to increase placement stability, and efforts to increase caregivers in terms of foster care providers and potential prospective adoptive parents. So I'm happy to give copies, but I'm moving onward, just to wrap up and say, I hope to encourage, this is a space I try to be in, thinking about my space of action. We spend time thinking about disproportionality, disparity. It is a complex problem. There's no one single solitary solution, but it's going to take a lot of action from a lot of people. I often ask myself, well, what can I do? Sometimes I think, well, I'm just doing research and that's just it. And what is that? But that's not the right way to think about it. It's no, there's power. We all hold power in our space of action. And if we can continue in our space and come together collectively, then we can move forward. And I want to emphasize that call that was mentioned already. We can make a difference. So some ways that we can do this, moving from in the research arena, and then also as on a system level and agency level, moving from a fixation on deficits to strengths. And this is something that goes back to that original chart around messages that are fed to us about implicit biases and about society we live in. There has been a fixation on deficits of Black families, of Black parenting, of Black communities, and we know better, right? So we know about the strengths and resources we have. I've listed some potential here. We have our churches, sororities, fraternities, extended families, the formal and informal kinship networks that are part of how we do things. We can tap into, and this is a short list, but we can tap into the resources that we have, tapping into our legacy to thrive, create, beautify, innovate in the face of adversity, and use these things to move forward, especially at a time when there are movements and there's a momentum that I would argue is unprecedented in the past. So there's the upend movement. I don't know if how aware this is something that is starting, and really the point is to push back and say, hey, we can't just continue this. The idea of reforming is not working, and we need a total we need a recreation. And it's not this idea of dismantling and doing away and saying no more need to support families, but it's actually just asking us to radically shift how we view safety and protection of children, and imagine a society where keeping children safe no longer requires separating them from their families because of the trauma that can cause, and instead viewing children as the most safe with their families in their communities, and also involves like really dismantling racist policies and practices that have contributed to the problems we see. Thinking about momentum around grassroots efforts, community-based efforts. There's a lot of discourse around funding streams at this time, and how funds are directed to the child welfare system, and how that might be shifted in order to support families, and hopefully just continue to be empowered through information. All that is a reimagining where we truly, not only us, but society recognizes that race is not a risk factor. It's actually racism, and that we can do better. Yeah, thank you.
Thank you so much. The only thing I don't like about Zoom webinars is that like I can't give you a round of applause. I don't know if that's an option via webinar, but that was incredible. So I wanted to, for our participants, we're going to make some space now for a Q&A before we have our last panelist share. And so I have a couple questions in the Q&A. So just a reminder to use the Q&A. You're welcome to use the chat. It's just a little bit harder to keep track of questions in there than in the Q&A. And then if you have questions, I'm going to jump right in and ask the questions that we have here. But if you had a question that you wanted to pose to a specific panelist, please make sure that you put that in the Q&A. So I'll just get started with the two questions that we had come in while Leshia and Shaundricka were speaking. And so it says, as foster and adoptive agencies, how have you seen the change and impacts on disparities since the racial injustices in 2020? Have numbers increased for foster families wanting to provide a safe environment? Oh, I guess this is the question for me. Well, I can say, and Leshia and Shaundricka, feel free to jump in, but we have definitely seen my workload just about tripled in 2020 with the number of people that we had interested in wanting to foster and adopt. But I will say that wasn't necessarily tied to an interest specifically in, wanting to end disproportionality and disparity. So we didn't have like an influx of families wanting to parent Black children, but just overall, and I did see that across the board with some of my friends at other CPAs. I think whether it was the virtual learning or kind of coming to terms with, if not now, then when, I think there was just a greater interest overall in wanting to, people wanting to start their families and grow their families. But I did not see a connection to an increased interest specifically to Black children. And then the next question that came in, it says, are there any new trainings or opportunities that have been modified or added to ensure that prospective families have a knowledge base on disparities across systems? And I don't know, Leshia and Shaundricka, if you all have, if that kind of touches any of the work that you do, but I'll let y'all answer, and then I could add a little bit of input just with the training that I provide.
So I mean, I know over time for us, our knowing who you are, that's our diversity training. It's certainly different from when I was a worker. And then we offer, I can't think of the name of the training, but we offer an additional training that's a diversity training. And it really has people check their privilege. And I will definitely say it's one of the more eye-opening trainings because it really challenges folks to really, again, check their bias. You have to really address any stereotypes that you might have. And it really helps you acknowledge your own privilege, whether that be white privilege or male privilege, female privilege, whatever that privilege is that you have, it really helps you address those things. And so having observed the training and have taught the training, it was very eye-opening. So I know that those are some of the things that the department has done with regard to training.
And we also, with our disproportionality liaison, she continuously sends us links for external trainings so that we can continue to stay focused on basically enriching our skills set in regards to disproportionality. And so she's done so well. And sadly, our disproportionality liaison Tanya Rollins is retiring. And so that position will be vacant until it is posted. But we have, like Shaundricka said, we do have these internal trainings, but we know we need more. We need to have a bigger lens on the work that we do. And so we really look to our community partners across the state of Texas and even into other states to provide training to us. And so each month we get multiple notifications for training to be shared with our staff in order for them to participate.
Thank you. I think that's a really great question. And I'll talk a little bit about at the end about our It Takes a Village initiative. But one of the components that I'm working with an organization now on being able to provide some additional training to our foster families that I think would be just as easy to translate for professionals in the field on, viewing how to look at this holistically, how to recognize your biases and why the way he posted is it okay to be colorblind? The answer is no. But having these conversations with our families first, and we haven't set a date for that, but for those of you all who are interested, you'll get my contact information at the end. Once we set dates, I'm happy to, once I make sure that it's, shareable, right? Like I don't want to invite y'all to something and then I'm like, it was terrible. So once I sit in and participate and feel like, okay, this will be a really great resource to share with people, I would be more than happy to share that as well, because I do think that there's a huge need for just access to education and training about the topic. And so I won't keep talking because there are just questions coming in. So this one came in, I believe, is for Reiko. It says diversifying child welfare agency workforce has come up a few times. Is this an issue statewide, region 6A, 6B? Where I see a lack of diversity is in court-appointed special advocates and the courts rather than in DFPS or agencies.
Yeah, so I actually think that's probably more of a question for those. I'm not aware of the level of diversity among the workforce here in particular versus the court or CASA. So I would defer that question.
Well, let me talk about Region 6B. I meet with the executive directors and program directors for CASA for my region, and that's 12 counties. And one of the things just this month that we did talk about is the population of youth that we're seeing based upon their race or ethnicity and even their gender, because we have to. The conversation today is about disproportionality and disparities. But when I had my conversation with them, it was about also, in addition to, I need more African American CASA advocates in the counties where I'm seeing a bigger growth of African Americans and Hispanics in those counties. We need to get those advocates. But I'm also looking at advocates to help support youth who are with gender identity issues that are coming up more and more. And so those things we're talking about, what can we do? I know one of my areas is really working on having a coffee and chat in the community to start engaging about all of these things. So we definitely know that our advocates within CASA are willing to partner with us in this work and really making a concerted effort in their recruitment to have advocates that match the landscape of where we are in CPS at this time. And as one executive director said, yes, our older ladies in CASA are great. They come in and they're there and they're great advocates, but we know that we need more men. We need more men of color. We need more females of color. And so they're willing to work with that. The conversation is open and out there and they're engaged in it for my region. Sean may know more about 6A.
So absolutely, we've discussed having more diverse representation with child advocates, because what we see a lot of times is that they, when you don't have that representation, that aunt, that uncle, that grandmother is overlooked because they're poor, because they're uneducated, because they're single. And so to combat that, we can certainly ask for, that level of recruitment. But to combat that, John and I, whenever there is a new batch of advocates, we offer training to them around that diversity, around what it means to really have a different lens to look at these cases, and what it means to really meet these children where they are and understand their history and talking to their family members despite them living in certain zip codes. So John and I have we've definitely tried to do that. The other things that we've really tried to do is for certain populations, for my dual status group, I know that there's an overrepresentation of Black boys in my dual status group. And so we've tried to assign a child advocate to each one of those kids. And we've tried very strategically to assign them certain advocates. So advocates with certain backgrounds, male advocates, folks that look like them, because we hope, again, that will help them, come out of those systems. And thankfully, a lot of them have, one, not reoffended, and two, they've been able to get out of at least one system. So we definitely understand that, that there's a lack of diversity, but we've tried to do different things to try to combat that.
There were a couple questions that came through about Dr. Boyd's PowerPoint presentation. She just emailed it to me, so I can share that with all of our participants. Thank you so much for sharing that with us. And I guess y'all can see these questions too. I'm just kind of going through them, but there was a question about the slide about the legislative updates and recent legislation and how those affect disproportionality. Do you have an example of how legislation impacts disproportionality?
Mm-hmm. Sure. So I can talk a little bit about, so what I was referring to in terms of recent legislation, it would be an example more of kind of conceptually or theoretically how it could impact or where some of the momentum is in terms of recent legislation and how it may um, shape how we're thinking about what it means to help and what we can do in terms of prevention. So there's a lot of debate. There's the Families First Act, which is the most recent legislation passed. It really, it's a lot of people talk about it as a really big deal based on the fact that, okay, now there can be some funding for preventative services before to help children avoid being placed in foster care, right? And so this idea of, wow, we can get some supportive services to children, to families, to help them avoid being placed in the system, which is a really great thing. And it's like the idea behind it is it's right on point. However, there's some barriers in terms of requirements for evidence-based practice and what qualifies as an evidence-based practice. And I don't want to get too detailed in terms of, what all these things, because I'm not sure, as I keep mentioning, I'm not sure how interesting that is to everyone. But what I mentioned recent legislation because I think, I would argue that more now than ever, here we are having an acknowledgement that there's something wrong. There's something wrong, and there's some issues with our funding streams. So if you have to be placed in foster care in order to access services, doesn't that defeats the purpose of what we say our goal is if we're talking about child and family well-being? If there is a need that could help a child stay with their family of origin, if there's a material need, and that's what needs to be addressed in order to keep them from entering foster care, to promote safety within the family, then let's eliminate those barriers. And I think there's some momentum around that's reflected in some of the so at the heart of some of the legislation, despite the challenges. And so I think this is a time where building on that type of momentum is important. There's also in Families First, on a positive note, which I'll end on a positive side, there is increased funding and attention given to supporting kinship kinship care providers. So like through kinship navigator programs and all this, which is needed, and also looking to support who are not kinship care providers who don't actually have open cases with child welfare systems. Could potentially be included in there. That's not to say that there's not challenges to that or red tape even within the legislation itself, but those are examples of what I would argue are some positive changes and nuances that are included by being addressed that really haven't had given the same attention in the past. So they haven't been studied yet. So in terms of data on that, I don't know if that was part of the question, but yeah, so no data yet since it's so new, or no research studies done on the impact of those specific policies, but that's a great question.
Okay, next question. Has any of your research provided data on how the courts impact kinship placements? Harris County CPS and the judges often do not agree on where children should be placed.
Yeah, that's actually that's a phenomenal question. And the quick answer is no. And the reason no to research on this exact topic, part of what happens in child welfare research on racial disproportionality disparities is that there are key gaps that have to do with the nuances of being in practice. So many times these issues are studied in terms of large administrative data sets. And even as I mentioned in my presentation, taking a step back from a national or even just a state level picture of what's going on, a lot of what's happened is the child welfare research on disproportionality and disparities has focused on really saying, hey, is this a problem? does it even exist? So let's look at the data to see if it exists. Then there's a shift in studies that say, okay, this does exist. Well, let's compare outcomes between groups, and let's look at risk factor. You know, there's different line. If you follow the research, you can see different lines of inquiry, but it's very sparse in terms of, one, the lived experience of people who have been impacted by the system or who are involved in the system. So that's understanding, well, what do children, what do families say? What has their experience been? There's a gap in the literature there. And then in terms of actual these the decision points that I mentioned in my presentation, or even the in the nitty gritty, we know if you have practice experience in the system, you know that at the court level, that's a extremely important decision point, right? But there has not been a much research attention given to understanding the specific dynamics that might impact kinship placements, reunification that happen at the court level or judge level. I know that there are efforts of training for judges, you know, court personnel in that sense, but yes, no real representation in the literature about that impact.
I'd like to add, I know that there was a question specifically regarding Harris County judges. So since the last election cycle, we've definitely seen a great shift in kinship placements and reunification where it concerns CPS cases. As you guys probably saw all the headlines, a lot of our judges are African-American women. And so they really challenge us to, one, meet families where they are. To get rid of the barriers. We've done everything from buying groceries to paying phone bills to try to make placements happen. And they really pushed us to make that happen. And we're appreciative of that because, you know, unfortunately, we had judges in the past that if a family wasn't introduced at show cause or by status hearing, they were not being moved from that 2-parent picket fence foster home. And so if Aunt such and such came late in the game, it wasn't happening. And we experienced that time and time and time again. And unfortunately, we're still dealing with a little bit of the fallout from that. But you know, it's certainly gotten better. And so I'm so happy now that we have, you know, this new slate of judges that just have a new lens about child welfare and what families look like, and that families are going to look different. And so I know that they've tried to really turn the page as far as like ad litem appointments and really appointing ad litems that are, again, diverse and that look like the kids that they serve. And so we've really seen a lot of changes as far as that is concerned.
I think you kind of touched on this, Shaundricka. I think this is addressing one of the things that you mentioned during your presentation. It says, I left the thought to try to keep members with families as a portion of the assessment looking at the life of the parents and how often do parenting classes make a difference, and have parenting group therapy been considered? And given what you talked about not automatically letting legal issues impact placements, have you seen an improvement in placements for African-American kids since, you know, in your role, you've made that shift, and I'm sure you're encouraging your staff to make that shift as well?
Yeah, absolutely. The other day I read a case and saw an aunt who was actually a play cousin, and you know, it wasn't somebody who was actually related, but it was somebody that this kid valued, and that was important. It's not important that, you know, how I think or who I think is, you know, this kid is, or who I think this person is. It's that this kid sees somebody that cares about them and looks like them and sees value in them, and vice versa. And so I owe it to that kid to thoughtfully consider that person. And then, so in doing so, we saw that this person had criminal history. And so instead of, I always tell my staff, instead of saying no, what can we say yes to? So we know that we can check the boxes here. We know that we can do that here. And so if there are some no's, how can we create safety to address the no? Because something that happened 15 years ago doesn't automatically mean that that person is unsafe. it means that that person has a past, just like we all do. And so we really, especially, you know, now that we have the capacity issues that we have, we are getting more and more and more creative. I'm reading cases from way back when to try to really do some family finding, and not necessarily just with an eye of placement, but with an eye of connection, creating those connections, because it's nothing like not having somebody that doesn't know you or know your family history. And I always think, like, just imagine like not being able to say, oh, well, me and my cousin used to go over here and buy French fries for $1.07. That's one of my memories with my cousins, you know. And just imagine like not being able to say that about somebody, not being connected to those same folks. And so I just constantly try to think about those things whenever I'm reading cases. This is not just paper, these are connections. So just trying to really continue to make those connections.
And this question, I'm going to jump down to a question that just came in because I know she has to hop off soon. But the question is about what is the data on disillusion of adoptions, and is there racial disproportionality in that population? Is there data about what families racially are returning the children to care after adoption? I have thoughts on this, Cynthia, but I don't have data. Does anyone, I don't know if any of our panelists have any information on that, like statistics wise.
Yeah, I don't have any statistics, but I will definitely say the disruption staffings are definitely the least part of my day. And so I've been a PA for a little about 2 years now, and I've tried to attend as many of those disruption staffings as possible. And we really see that a lot of it is like this kid grows up, and this, you know, you have a white family who adopts this African American or Hispanic kid, and this kid grows up, and around 12 or 13 they start to ask questions about, who am I, where did I come from, you know, why is my hair kinky, you know, they just start to ask questions about who they are. And I think a lot of foster parents don't know how to address those questions, and so they try to do other things to supplement. And you know, we've had folks go to therapy and different things, and there's nothing wrong with that. But sometimes I think I did have a family where they had adopted a while back, and so that family contacted DFPS, and she was like, hey, I have a closed case, but I have a question. Would it be okay for me to look up the birth family on Facebook and make connections with them to answer these questions about the girls, because they're starting to act out because they don't know their family? Absolutely. This is your family. Manage this situation how you want to. And so that was probably maybe like 8 months ago. She reconnected with me last month, and she said that the girls have made like almost a 360. And so I wish that we had more foster parents that were willing to do things like that. And I get that they're afraid. I get that, because I could potentially lose my baby if I reconnect with these folks over here. I get that fear. But a lot of that acting out comes from what they don't know about themselves. And so it's unfortunate that we do see that a lot.
Thank you. I want to make space for our final speaker. So what I will do for the rest of our panelists, if y'all have any answers to the remaining few chat questions in the chat, if you could type an answer response, if you have any response to them, and whichever ones are still lingering, I can go in through and respond. But I want to make sure I give some time for Felicia to share, and then if we have some more time at the end, I can come back to the rest of the questions. So thank y'all for hanging in there, all of our participants, and feel free to continue to put questions in the chat. We can answer them as we go. But our last presenter today is Miss Felicia. I connected with her through Reiko, and talking to her by the end of our conversation, I felt like I was talking to an old friend, and I was so excited to have her come. And I had never met her before. I was like, I feel like we could be friends. And so I want to make sure I give you the space to share, because you know how I feel about what you have to say. So please give your attention. Felicia is an adoptive parent who I just asked to come and share a little bit about her experience and her thoughts on, the adoption, fostering and adopting Black kids in care.
Hello, everyone. Good afternoon, because it is afternoon. I was asked to speak about my experience as a foster adoptive parent. Give me a minute here. I'm a little nervous. My experience is a lot different from other families that I dealt with. We had our children come into foster care at the ages of, they turned 1 and 2 in my care. So I'd had them for relatively a while. When they turned 1 and 2, I didn't adopt until they were turning 5 and 6, the summer before they turned 5 and 6. So we had a case end and then another case begin. Rights were terminated, and we kept up the fight, and eventually we won. And I'm a little concerned here because I know that everybody is concerned about reunification, and in some instances that works. In mine, it didn't, and so they are my children now. Ashley asked me to speak on some things that are near and dear to me. One of the things she talked about was support and what support did I think we needed at the time. I think the child placing agency did the best they could with what they had. For me, I would have liked more support in that. I had 3 kids already. These 2, when they came into the family, it was like, it was overwhelming. I never forget, they came in one summer and my daughter was down from college, and and they were, my older kids, they decided they were going to go spend the night somewhere one time. I'm like, hey, who's going to help us with the kids? And my daughter looked at me, she said, consider it a soft opening, and left. And so we did the best we could with what we had. One of the things I really thought that we could have used was a tribe surrounding us, lifting us up, especially when we went to court. I think we went to court. Me and my husband attended every single court case that involved the children until they got to the last one that no one told us about. That CPS was doing something else with. I'm not even going to get into that. But those court cases, they were draining. And so if I could have just had a meal at the end of that court case, that would have been like, I don't have to cook today. There's one less thing I need to think about, because it was so much on at the time. One of the most helpful things was in the second go around, after the 2 years, we had like more time after that, another year and a half. We had a CASA worker. She was helpful. The agency, when they came to, when they had different functions, they were helpful. For me, I would have preferred, I'm just gonna say it, I would have preferred a support group, someone that would have been there during all of the court cases, someone who would, just be able to talk to someone about my experience. At times I felt like a little closed off, and it was me and my husband against CPS, me and my husband against the birth parent, which I really felt like, I didn't hate this woman. I really wanted her to understand that, hey, I'm here to assist. Can we at least try and work together? But at times I felt like her lawyer pitted us against one another, which I thought was really, really sad, because I think we could have worked this out and worked through this had we just come to the table and talked. One of my biggest challenges was the amount of time this court case went on. I had to get an attorney. I have so many concerns and issues with CPS I'm still trying to get through. And that was because at times CPS was not supportive. At other times they were, they were supportive. And it was like, we walked into court one day with CPS saying, these kids going back to their parents and we're done, and we've thrown up our hands. And my attorney is like, yeah, but you all are the ones who brought the case. You just can't drop out. Just in the middle of the case, CPS changed their mind. So it was extremely stressful. I think our children have so much stacked against them that they need someone who looks like them to help them navigate the system. I shared with Ashley that we had been in this system for a while, and I asked the kids' attorney, I was like, hey, we're gonna take a vacation in a year. You think this court case will be solved? He said, oh yeah, go ahead on planning your vacation. Kept getting closer and closer to it. I'm like, okay, this does not look like it's getting solved, but I've bought tickets, we're leaving the country. By the time the court case came, it was like, okay, by the time the vacation came, it was like, okay, we are like right on the edge. I can't ask this judge to let these kids go out of the country because they was about to be returned to their parents. It was just like so much going on. And I was like, hey, what am I going to do with my kids while we go to court? Because in my mind, they're still my kids. So like, what am I going to do with them? And so they said, oh, we'll put them in respite care with another family. And I'm like, okay, we worked it out. We went into respite care. Now, mind you, this was Christmas. The kids were supposed to be with us. So like I fly back into town the day before Christmas to go pick up the kids so that they are with us for Christmas Day. And we're not bothering this other family who's been nice enough to give us respite care. And I go to pick the children up. And they were in a closet. I was extremely uncomfortable with that, but I was like, okay, they turned their closet into a bedroom, but it's still a closet. Thank you for keeping my kids. So, because I had a lot going on, and I appreciate you keeping the kids, but I'm like, they send the kids here and they sleep in the closet. I called my husband, I'm like, these kids, they were in a closet. He was like, a closet? I'm like, no, they did keep the kids for us while we were able to go on vacation. I'm still a little bothered about the closet, though. That was the closet. So I'm like, what standards are we having? Because the majority of the kids they had in their care looked like me. They did not look like me. So I just think that we have I'm trying my best to sound politically correct here, but I wouldn't put my children in a closet. I just wouldn't put my kids in a closet. They need a room with the window. I love natural sunlight, and people knew that they were putting kids in closets. I understand they had beds in there. Yeah, okay, I'm gonna move on from that. So what I think one of the things that I would need was someone who, with respite care, that cared about my kids as much as I cared about my kids and wouldn't put them in a closet. Because for me, that's saying I care enough to give them a safe place. But if I wouldn't put my kids there, if you wouldn't put your kids there, you shouldn't put my kids there. There needs to be a level of dignity, respect that comes from people from our community. Not saying that, but there needs to be a level of dignity and respect there. What has been my biggest and best result of all of this? What has been a triumph for me? Maybe 2 years ago, I took one of them. 2 years ago, I took my daughter and my whole family, we went on a cruise together. And I remember sitting there looking into the face of my daughter, and she was so excited because this was like huge for her. And I thought, I had changed the trajectory of your life. Had you stayed in that environment that you were in prior, you wouldn't be here. I've made an impact. I'm not perfect. I'm doing the best I can, but I have made an impact. My son won a prize when he was in pre-K. He won the a robot contest at his school. He was placed on HISD's website. It was like a huge to-do. I have changed trajectory. You're going to have a different path. Your mother didn't graduate from high school, but you are going to have a different life because I gave you that opportunity. And if we would give more children that opportunity, more children in our community that opportunity, it's all worth it. I think my son we've talked about African-American males, he is quite a handful. I'm a teacher. I have taught students like him before. Dude, I need you to calm down, go sit down. They're extra. And I am not gonna pistol whip you. I have seen my coworkers that are willing, ready, and able to pencil whip you. I'm just gonna try and understand where you're coming from. We're gonna try and work this out together. Because I believe because of who I am, how I've always dealt with and interacted with his teachers, they are willing to work with him as well. My son would come home every day on green. That was like the color for kids. I was like, and then one day he said, "Oh, I only had to walk around the track a couple of times a day, and then I got to play." I'm like, "You got in trouble at school?" Teacher never sent a note home. So one day I see her in the hall talking to her. I'm like, "Hey, Kurt's been giving you problems?" She says, "He's just a little boy. It's okay." She was like, "It's fine." She said, I just love him so much, it doesn't even bother me." She did not look like me, but her heart, she had him in her heart. And that's the one thing I know, had I not been his mother, I had not had that relationship with her. A lot of those things that he did that I know irritated her, she would have taken out a pencil for, but because I had established a relationship with her early on, she knew his story. She took him up under her wing. Those things just didn't seem to bother her as much. She was like, "That's who he is. I love him." And girl, yeah, he's still coming home on green, even when he over there doing extra stuff. I was like, well, thank you for loving my child. So my biggest thing is trajectory. We are trying our best to change the trajectory of these children. And sometimes it takes us who, and my kids have those questions. They come to me and they ask me about their parents. I tell them as much as I can. And the day finally came when, "Oh, your mom she just wasn't able to do, for you. And so, she had to let you go." My daughter's like, "But why? Well, why couldn't she?" So we have those conversations, and I tell as much as I can while still trying to help them navigate that. And I know that the questions will get deeper and more concerning, and they want to know, they have questions, but I try my best to answer them as best I can, knowing that I fought for you. You were mine because I loved you and I chose you and I fought for you. They still have questions though. Is my love enough? Well, we just gonna keep on trying and we'll see. I'm open to questions. I try to keep in my time.
Thank you, Felicia. You do have one question that said, if you don't mind sharing, were there any Black attorneys, ad litems, or judges on the case? If not, do you think that would have made a difference?
Deliver me. I shared this with Ashley. There was one Black attorney on the case. She happened to be the mother's. I shared with Ashley, once we were in court one day and my husband and I were standing around the judge, and there were about 10 of us. Me, my husband, my attorney, the district attorney, the children's ad litem attorneys. My husband said, it's 10 people making the backs off of 2 children. And I'm like, he said, and we're 2 of them. And I'm like, wow, the system is not set up for us. The one attorney that was the mother's attorney, and she fought hard, because she said she'd seen enough of these cases where these children were taken from parents. I respect her to a certain extent, but the district attorney was Black, but there were different district attorneys throughout the case. I think she went out on maternity leave, but that was about it. Everyone else looked like colonizers.
Okay. Thank you again, Felicia. I didn't see, just scrolling through the questions, I didn't see any more questions specifically for you, but I really appreciate you sharing your perspective and your experience. I don't think there's anything more real than a parent who has lived with it. And like you shared, I know we spent a lot of time talking about kinship care and reunification, but I think we would be remiss if we didn't discuss the importance and the value of our foster and adoptive parents that are doing this work, because our kids wouldn't be where they are, and reunification is not always possible. And we definitely need people to step up and, serve our children in this way. And I'm just trying to scroll really quickly through the chat to see if there was anything else that we missed. Some of this seems more like comments. We had a CASA board member that just sharing in response to the need for more CASA members of color, just sharing that on the board, she does see that there are a lot of initiatives around diversity and equity and inclusion within court-appointed special advocates, which I think is wonderful. And I think the only other question that is left, and I don't know if any of our panelists would have a response to this, but there was a question about the Governor Abbott signing the new abortion bill and women not being able to terminate unwanted pregnancies. Do you think this will cause more children to enter the foster care system? And do you think more children of color may be represented?
I can only say this. When I went to court in Harris County, and the number of our children that appeared in the system in that court is heartbreaking. Rarely did I see anyone else that did not look like us. It seemed like, I told my husband once, I said, we cannot be the only ones that are abusing our kids. I find this hard to believe. I didn't see anyone else though. I just saw us.
And I have thoughts about that, but I don't have the research backing for my thoughts. But I will say that I haven't done a ton of work with Planned Parenthood, but historically, women that are looking to terminate their pregnancy, I haven't seen, in the little work that I've done just working in private adoption with birth moms, there's not necessarily a direct correlation between, the inaccessibility to pregnancy termination and an increase in children coming into care. I think it's more likely being tied to access to preventative measures like birth control, and like Reiko kind of talked about in her presentation, just access to services across the board. But I know that question came from one of our families, so I would be happy to talk to you a little bit more and even just do a little bit more digging to be able to answer that question. But for the sake of time, I would like to just begin wrapping up. If any of our participants have any other questions, please feel free to email me. And I'd be happy to reach back out to our panelists to field some more of those questions. But I wanted to just share my screen because now we're at a point where it's okay. So we've heard about this, and what does that mean? What are our next steps? And I think for us at Arms Wide, we have decided to make it our focus to make sure that the work that we do, being proactive and making sure that the work that we do and the children that we're working to end disproportionality. All we can do within our agency, and for all of you on this call within your fields, is hold yourself accountable. It does take all of us being willing to acknowledge I may not be able to do everything, and I may not be able to change the life of every single child in care, but I can change the life and the trajectory of one child in one way. And so I think that having that mindset and understanding that there is something that you can do is really important. Duana, are you going to pull up the presentation, or do you want me to? Okay, I was about to pull it up, but I didn't know if you already had it on deck. And so for all of you all on this call, if we're thinking about just like practical next steps, what can I do? At Arms Wide, we're launching an initiative that is being fully funded by the Methodists, which we're so excited about, called It Takes a Village. And I don't have the time to go into all of the details of this, but I'm so excited about this because it's not only something that I'm passionate about professionally, but also personally. I think about, often, and it makes me really sad. I'm a mother of 2 little girls, and I know that if my kids entered care and Arms Wide was contacted to find a family for no other reason than because of the color of their skin, their option of family placement is cut in half. And I'm not okay with that. I'm not okay knowing that there are wonderful kids out there that are deserving of the best opportunity, and their opportunities are drastically different just because of the color of their skin. And so if you're on this call and you're trying to think of ways that you can connect and be involved, we are creating this initiative to bring in more families, to create a committee of like-minded community members to help push this mission forward. So maybe you're not sign me up to be a foster parent, but you do feel passionate about this and you want to make steps to make a difference. Please, I'm gonna send out some links. You could join the advisory committee. We're gonna meet hopefully monthly or every other month just to have some conversation and make plans to see how we can further engage our community, spread word about the need of our kids in care. There's also going to be other opportunities to be involved. So just like Felicia talked about needing that ongoing support, we want to be able to connect people who are willing to support with families who have a need for support. And so there are opportunities there. I guess I need to share my screen. I didn't think about that. I have to, we have our It Takes a Village page is now live on our website, and you can come here to just get connected with us. If you would like to join our village in any capacity, maybe you aren't 100% sure, we have a few options listed here. I'm going to be fielding all of the requests that we have. And this is you just saying, you know what, Arms Wide, I love the mission. I love the work that you're trying to do. I want to do my part to support it. And this is open to everyone, whether you're on this call and you work for CPS, another child placing agency, hospital social worker, church member. Come join us. Let's do this together and really bring an end to what's happening in our region, because it's bad. It is bad comparatively to the state. So I'll be sending out a link to link you directly to this page to sign up. There's also a link to the overall initiative, which is called It Takes a Village, just so you can learn a little bit more about what we're trying to accomplish and how to be involved with next steps. And then finally, I would say maybe you aren't in a position or you aren't interested in becoming a foster or adoptive parent, but you know someone who is. I would love for you to invite them to our information meeting. And at that meeting, it's going to be specifically for It Takes a Village. But I'm also going to be sharing a little bit about other ways to get involved. So like I talked about, if you want to be a part of supporting a family or joining an advisory committee, but you don't have time to to have a one-on-one phone call with me. That meeting's going to be in a couple weeks. So I would love for you to join and just learn a little bit more about what we as an agency are doing and how you can get connected to us and be involved. Because there are a lot of kids in care that have need. I was helping with broadcast, which is the placement request that we receive, and it really affected me. I had conversations with my director. I was like personally offended sometimes when I didn't have families to call about an 8 and a 9-year-old just because they were 8 and 9 and African American. I'm never going to be okay with that. And so I encourage you to connect with us, to see what we can do collectively to bring an end to disproportionality and disparity in our region, because we can all do something. And so finally, I would just like to say thank you again to our panelists and your insight, just for taking the time to share your story, and your expertise. I definitely will be connecting with everyone again. If you haven't gathered that from all of my many emails, I really like to connect with people. And I think we're all doing really great work and can continue to partner with one another to move this mission forward. And so we have about 10 minutes. If there are any other questions, let me see if there's anything else that popped up in the chat. We have an attorney that was just saying that she has been representing parents and children in CPS cases since 2013, and she's never represented non-Black children or parents. Thank you for that, Attorney Jones. And I'm trying to see if there was anything else. There was a request, if not done, can you all write up new guidelines that incorporate the removed barriers that have been identified under current judges? Because from past experience, when affirmative action disappeared, people of color to medical school was lost as well. When we lose the Black female judges, will things go back to the old way? Oh, I think that's a real concern. Importance of getting out there and voting. But I don't know if anyone has access to that, that is outside of my purview, but if any of our panelists do, please share that with me and I can share with the group. And then the last question is, since there's disproportionality in the system that affects children, are there available supporting services for African American children that are currently placed and after they're adopted? I will say that's one of the things that we're really wanting to work on with It Takes a Village, is providing connections to resources within the city. Oh, which is what I forgot to mention, we'll also be having a resource page. So if you're on this call and you provide a service that you think would be of benefit to families parenting children, please go to the website and enter your information, and we'll be posting resources on our resource page specifically to help connect children and families with organizations in the community that could be a benefit to them, that could provide supporting services. So if you're a therapist, an attorney that specializes in something, a therapist that specializes in, childhood trauma or complex historical trauma and how that shows up in transracial cross-cultural adoptions or foster adoptions, period, please go to our resource page and post that information. If you facilitate a support group that you would like for our families to have access to, please share that information with us on our resource page as well. But other than that, I want to be respectful of everyone's time. And I really appreciate that you all have hung on through the whole webinar and have had such wonderful questions. My contact information, Carrie, I see Carrie posted the links to the webpage and to the information meeting, so you can check those out. Everyone that was here, I'm going to send out just a follow-up email, which will include the links. And we'll also include the training evaluation that we need in order to award CEU certificates. So just be looking out for that email as well. That will come from me. And I'll put my contact information one last time in the chat. Please, as I mentioned, we're really passionate about this initiative and just the overall mission. So if you want to connect and you don't remember anything that I talked about, the ways to get involved, and you just want to email me directly, that is fine too. I would be happy to have conversations and make connections, because it really does take a village to be able to address the needs of the kids that we're serving. And I think all of us in the work that we do, we have an opportunity to occupy a space that I feel like has been vacant for far too long. So let's come together and work together to address what's happening to our children. And for our panelists, do y'all have any last words that you would like to share with our attendees? No, Shaundricka said, no, I'm done. I've
I
talked
just
enough.
want to say thank you to you, Ashley, for allowing us to participate in this. And I also learn from every interaction and listening to Ms. Felicia and Ms. Boyd. It has been just wonderful hearing from you guys. And I was jotting down notes to take back to talk. I have a team meeting actually starting in a little bit with my supervisors and a whole bunch of other folks. And this is going to be my topic of discussion with them today. So to continue to move this forward. So thank you all for sharing and keeping this work moving forward. I definitely appreciate it.
And I would just like to say thank you to each one of you on behalf of Arms Wide Adoption Services, each of the panelists, all of the participants who signed up and hung on throughout the webinar. Thank you for the work that you're doing, whether it's in child welfare or supplemental or complementary to child welfare. As Ashley mentioned, this is an initiative that's multifaceted. It's not just about creating or recruiting foster and adoptive parents for African American children, but it's about creating a community that supports families who are kin caregivers or relative caregivers that are caring for their children who are their relatives or kin, and building a village to support them, as well as creating awareness about the issues of disproportionality and disparate treatment of children and of Black children in child welfare, so that we can disrupt this and start the process of making sure that we have enough families, enough support for these children once they enter care, if they have to enter care, and to continue to work towards creating support systems that prevent them from entering the system in the beginning. So thank you all.
And I just want to say that this is a marathon. It's a journey and not a destination. We have our children and we still need support. It will grow you in ways you never even knew you were supposed to grow. But the mission of raising these kids is something that you won't understand unless you take the journey. And to have that support from people around you as you do this, because it doesn't get easier, but it's worth it. It is so worth it.
Thank you. Thank you. Thank you. And thank you for really, truly, I know you had no idea who was calling you and what I wanted from you, but I really appreciate you just being willing to share your story, your journey, and your experience. I know that it is really valuable information. And the only thing that I forgot to mention, don't want to touch on it with It Takes a Village, is part of our funding is to support Kinship Care. So if there are, Leshia and Shaundricka, if you are meeting with any of your kinship staff, just please send referrals our way. We now do have the funding to help support kinship homes to get through the process. And so that is part of this initiative, is to be able to pay for some of the expenses that oftentimes prevent kinship homes from getting a dual license. So as you're going back to your meetings, I would be remiss if I didn't share that little tidbit of information, because I know that can be a huge barrier. And we know when you have the money to do it, we definitely want to be able to support these families to be able to maintain care of their children. And I can send you some information over, Leshia, that you can share with your team. So thank you all again for your attention and your time. I can hang out for a little bit if anybody else wants to send me any questions in the chat, but otherwise you'll receive an email from me with information, next steps, as well as CEU evaluations for your CEU certificates.
Thank y'all. Bye-bye.
Thank you, Ashley, and everyone. Thank you.
Thank you, Dr. Boyd. It was great. I'm looking forward to more conversations with you on this topic.
Likewise, I would love that.
Okay.
Yeah.
I forgot I was muted. Thank you for your first. I'm even though you didn't have to do it in person. Thank you for being willing to as well, and for just joining and sharing. And your little one is so cute. I didn't get to see him before. Oh, handsome.
I hopefully can continue the conversation. I really appreciate this. Thanks.
Thanks for being a part of it.
Okay. I don't think there are any other questions coming through.
Okay, I can stop the recording if you like.